My idea was to fill the gap between the nurses not being part of policy and not being respected, not being valued as participants in healthcare policy, and being prepared to do that. So we started by thinking about, well, what does that look like? Painting a picture. So we had a real cafe, we had conversation, all that stuff. But as we developed this, it became more than just what does it look like? It really focused in on what's our identity? How do you see yourself in this role? And this conversation is extremely pertinent because how many nurses are involved in the infrastructure of a community? Now we think of ourselves as healthcare. Okay, well, let's give vaccines. Let's make sure that we have, we're taking care. Well, nursing is the profession is much more than that. We create teams. We look for best practice. We take action. That's what Florence Nightingale started with as an entrepreneur. She said, that's crazy. I got to do something. Went in and did it. Changed the entire structure of the greatest military industrial complex of all time, the British Navy and Army in the mid 1800s, changed the way they did business. So as a nurse, when you think about healthcare, everything is healthcare. If there's not water put out a fire, that's healthcare. If the air quality is bad, that's healthcare. If there's a homeless community that is not managed, not helped, that's health. Almost every single policy that you can envision, space exploration, everything, healthcare is that. And that's where we need to step in and stop putting ourselves in a box where, okay, we're going to talk about vaccinations. Well, wherever your interest is, that's where we need to step in and be part of this. And I think when we talk about the infrastructure, the failure of dealing with issues like this, how can't we help? If we're part of this, we ask the questions. Well, what about this? What about this? You go into any kind of your inner staff meetings, right before you go on your shift, you're asking questions because you don't want to get blindsided, right? That's part of our power. So if we are part of a community, whether it's city council or an advocacy group, we have qualities about that our profession can bring in, and that's our identity. And I believe that the cafe, what we're trying to do here is offer education, networking to help you be prepared to go advocate for whatever your issue is, but more so to expand and really fully develop what our identity is, because I think it's quite anemic. I don't think we've addressed it very well, and we don't think about it. And I believe that the more that we develop this, the more healthcare will change. The quality of our society will change the more we get engaged, the more we become involved. And so to do that, you have to be prepared. You have to have the confidence. You have to kind of know what you're doing. So there's the educational content. There's that. There's the networking. There's how you think about the thing. There's all these pieces. And as the cafe, what we're doing here expands, we're going to try and kind of fiddle around and figure out how we can best provide what people need. First of all, by identifying what people need and then filling in the hole. So each of our months, typically we'll have a presenter, and this one, what's going to happen? I wonder what we're going to end up with, because she's approaching her identity. She is advocating in a way that I think is a little different than many people think of as a nurse.
All right. So hi, everyone. Good morning. My name's Alice Benjamin. I've entitled today's discussion as Nurses in Media, from bedside to broadcast. And I think what Mike was alluding to was my creative way of advocating for different healthcare issues, practice, health policy issues using media, which is really, when we think of media, it's mass media is getting information out to the masses. And as nurses, we're more accustomed to taking care of that patient and their family, maybe even in our particular organization. But I have somewhat kind of struck out as a lone wolf, if you will, but in collaboration with my health organizations and colleagues, with championing messages in important messages in other areas. So, but a little bit about me. I am a practicing family nurse practitioner in the emergency room, and I do some family medicine. Prior to that, I was a critical care clinical nurse specialist, cardiovascular health critical care, and emergency medicine are my three jams. I'm also, by virtue, long story short, didn't plan for this, but this is where I landed as a medical correspondent as NBC here in Los Angeles. And that's just my advocacy being recognized. And I was afforded an opportunity to share it to the masses. I'm also a host of the Ask Nurse Alice podcast. I have what I'm excited about is a relaunch of the AskNurseAlice.com. I think I'll share some of that with you all as well. And founder of a company called MediaRX, because in this journey, as I've been able to follow my passion, and you'll hear my personal story, I've been able to learn how to navigate the media space, television, radio, podcast, digital, online, magazines and use my voice as a healthcare provider, but not just on diet and exercise, but other things about things that people need to know about, new evidence, policy, practice issues that we as nurses are going through, a variety of things that we normally um, have to go, I don't know, the norm that we normally talk about through our organizations. It's another means of communicating information and actually getting direct to the people who are responsible for voting. In media, anything you read, hear, or see can influence your thoughts and your beliefs. Those things then influence your behavior. So not only as we as nurses get to influence diet and exercise, how do I take this vitamin? Do I not? Right? Those kind of typical things to other things about helping them to shape their opinions around legislation, practice, policy, raise their awareness so we can garner the support of the community when it comes to shaping policy and practice. And that's things for us professionally, but then also outwards to the public. If it, as Mike was saying, let's say there's some discussion about changes in the sewage system or the water system, people are getting sick in a certain area. What do we need to change? As nurses, there's still an element of healthcare there. If it's about prison detention, rehabilitation of prisoners, there's the mental health there. There's the infection control that happens in the prisons. We have the ability, the knowledge and experience to insert our voices in many places. And using media has been a way to help me to get that information out. But this is some of me and my I guess my day job, if you will. But now I have done other things. I've been able to use my voice as a nurse in radio, TV, film, and publications. Um, I primarily do news, which is more substantive, direct to consumers and everyday listeners. But I've also done that on radio. Done radio. I've been able to insert and influence also TV and film, scripted content, because we know that also formulates opinions. If someone We've seen those shows where the nurse gets it all wrong. It's kind of like the doctor's apprentice, and like it just really formulates a poor image of nursing. So I've been able to assist with that, especially on this particular show, Fox's TV show, The Resident. I don't know if y'all watched it, but I'm one of the consultants on that show. And then also in written publications, whether kind of paper, I don't have one right in front of me, but like whether it's magazine in hand, do I have one here? Like nurse, I actually used to be on the editorial advisory board for this publication. But then also consumer health um, and other outlets. And now I get to do this. This is the fun stuff. Um, Coming on television to talk about important issues like the fires, and legislation, when things with the unfortunate killing of the United Healthcare executive, talking about some of this, obviously being very sympathetic to what's happening and sensitive to that, but also what's the other conversation about why are people upset about their healthcare insurance? So a variety of things I've gotten to do using media. So I guess my question here before I move forward is, has anyone considered, or maybe they've already done it, used media as a way to amplify their voice around an important health message, practice, or policy? Has anyone done it? Has anyone considered doing it? Does anyone want to do it? Yeah. Okay. And I would say, well, we'll get to that slide, but considering the amount of nurses that we have, we're the largest segment of the healthcare workforce. We should be at every corner, every station contributing, whether in front of the camera or behind the camera. Even working with journalists, I've received numerous calls from the NBC newsroom about different stories that come through. Like, hey, Alice, can you help us sift through this data? I don't really understand it. What does this really mean? You know, as a nurse, is how do you view this information as a nurse? Is this something that we need to share? And then with using our expertise to kind of help shape and inform the journalists who then tell the story to the masses. So, and you have to realize that media is very powerful. People are, whether they're watching it on television, they're watching it on their phone, listening to it, this influences their opinion. So if we really want to shape policy and influence how people vote, practice, or whether they support a particular legislation or a particular change, we really have to get the word out to them. And then there's my podcast. So here we go. What roles do nurses have? And please, by all means, unmute yourself, ask me a question. We're a pretty nice sized group here, so I'm happy to take questions as we go along. I just created a PowerPoint to make sure that I kind of hit some of the important things I wanted to make sure we didn't want to miss. So what roles do nurses have in media and policy? Well, we are absolutely, like I mentioned earlier, trusted healthcare advocates. We're the most trusted profession. Although I'm pretty sure firefighters are going to beat us out this year, but that's okay. We'll let them have their year. They deserve it, fighting on the front lines like that. But you know, we're reliable sources to the media. We definitely, many of the things we talk about, even if we don't have the answer, raising the question, right? To raise a question, to start a conversation, is very important, in influencing public opinion and also fostering trust in healthcare systems. We know that there's a big mistrust with consumers and healthcare systems, and we as nurses, I think, can be the bridge to that, to not only mend and repair that, but also we also have our hand back here to help influence healthcare systems. We definitely can leverage our experience to advocate for policies that things like improving patient care, public health, and addressing systematic issues. And I say in healthcare here, but really there's a little bit of healthcare in everything. Um, and I'll just give you an example. My son had you know, when it was his first semester of college, he was going away, he was living in the dorms. And I somehow became an informal dorm mom. I don't know how that happened. I think I was just poking my nose in and wanting to be present. But everything that I saw, I'm like, oh, we gotta fix that. That doesn't look sanitary. That's just like, you find healthcare with your healthcare lenses, you see things differently. We just do as nurses. And so we have the ability to shape things. Public health educators, obviously, like I did with as my informal dorm mom role, and crisis communicators, talking people through crises and walking people through to get to safe, make sure they stay healthy and they're safe, but then also contribute to help find out where were the missed balls, what are the things that we also need to um, address so we can get ahead. I think I heard someone saying that earlier about I don't know. I thought I heard someone say something about how we missed some there were some drop balls and we need to address it. Let's see. So, very much so. And I'll say that some people, I early on, before this became a thing, 'cause I think there's a growing understanding within the nursing profession that nurses should have a presence in media. And it's not to be popular, it's not to, not necessarily to be paid or anything like that, but it's to really to champion messages. So early on, I collaborated with the American Nurses Association, who I've been very involved with my entire career. I was on the board of ANA California back in 2010. I've been involved and I'm on the board of trustees in California here. I ran for vice president. I didn't win, but for national. But I've been involved in my professional organizations because there is an element of we're as nurses, we have this level of expertise, this knowledge, this compassion, but we don't necessarily know how to tap into media and to do this in a professional manner that represents our organizations and our profession well. So I did some work with ANA to help guide some nurses. So this I can share this article if anyone's ever interested in it, but it is online. You can review that. And I'll say this, nurses, okay, it's kind of fun, it's kind of cool to be on TV. Okay, I get it, right? But there's really there's to whom much is given, much is required. And it's really important that we in championing these important messages about practice and policy and legislation. And I understand some of the this work around health policy, some people there's like, well, there's kind of a fine line because I'm not in politics. I think we are, and whether we like it or not, it's an element of what we do. Because you can take care of a patient directly, or in a clinic, or in a home health setting, or at a school. But at some point, you're going to recognize that there's things change. There's rooms for improvement. Policy and practice are going to need to evolve as times evolve, especially as we enter in this era of technology, right? Um, all this computer stuff we're going to have to adopt and change policy and make sure we're doing things in the best interest of the patient. And so for nurses, if we want to be taken seriously, but sometimes I don't think we historically we've not been taken seriously, our voices haven't, we need to have a positive image in the public, and Hollywood has done us such a disservice in the past. And unfortunately, some of the images of what is happening today, and I'll just skip through this slide, is this. We see lots of negativity about nurses in media. And although we might feel like this is an excluded event, this actual media, again, influences people's thoughts, behaviors, and and so one of the things, if as we move forward with, and this is my angle of things, as I move forward to, and I have some examples, change and influence policy practice and things like that, it's really important that we as nurses bolster up our image with things. And it's hard when we have stories like this that are out there, and these stories, they use the word nurse, it's meant to be polarizing and clickbait, to because nurses are commonly associated with you know being so thoughtful, careful, and all these things. And so when you have people committing crimes and doing wrong things, they use the word nurse to polarize things, because sometimes the word nurse doesn't need to be a part of the story. Now, sometimes it does, right? Let's see. Yeah, some of these things are practice things related to healthcare, but you'll even see stories like, instead of uh woman kicks cat, you'll see nurse kicks cat, right? That's maybe not necessary, but sometimes the word nurse is used to polarize the story, but then indeed some of it is, we have some things that aren't well with our profession, right? Um, Now, some of these next slides, I'm gonna just go through a little quickly, but I wanted to give you some background. But there is research about nurses in media. Um, and again, media to help us amplify our voices when it comes to important topics, health education, policy, all of these things. And um, the first one of the first studies that's known to really highlight this was in 1998. Um, it was named after Nancy Woodhull, who was the founding editor of USA Today. She got cancer, was in the hospital, and she was like, "Man, these nurses rock. These nurses are here. They're taking care of me. They're being informative." Very impressed with the nursing profession, more so than the doctors who were actually ordering her chemo and all of these things. But she was very impressed with us, so much so that she did an internal review of her own outlet, USA Today, and wanted to look to see how often are nurses being used as resources to talk about these important issues that people need to know about. And so this was back in 1998. It was done in collaboration with Sigma Theta Tau, and let's see, look at the next slide. And so, and in fact, it was actually, the study was replicated 20 years later. And back then, only 4% of nurses were used as resources in health and in health news and in stories or in pictures and images. And when the study was replicated in 2017, it had gone, even though it's not statistically significant, it was less. So there, I believe, is such a missing uh, we are missing the boat here. There is such a gap, a missed opportunity for nurses to be in the media, to use that platform to amplify our voices. Oh, uh-oh. All right, next slide. Now, one might say, well, Alice, I want to, right? I want to talk about this important healthcare legislation. I want to, talk about something that needs to be changed, an improvement in the healthcare system, but I don't know how to do it. Well, that's because there's barriers in health reporting. One, journalists, they don't really fully understand the nurse's role, the work that we do with education. I mean, sometimes we can confuse ourselves, right? Because people will hear certified nursing assistant. Okay, well, that to them that's a nurse, so they hear the word nurse. There's LPN, LPN. They're essentially the same thing, but right, that's confusing. There's two. Then there's RN. Then there's NP. Then there's CNS, nurse midwife, and nurse anesthetist. But then, hey, what is this RN? ADN, BSN, MSN, all of this stuff, right? So people get really journalists get confused and don't really understand um, um, what kind of nurse am I looking for? I don't understand the educational levels, right? And they also don't know how to find us when they have a limited amount of time. News moves really quickly, so they got to find people. So unless you're someone like myself who's um, has a direct contact to a media outlet, or knows, or is in these rooms or in these online rooms with these journalists, they won't know how to track you down or find you, because if they go to your hospital is going to direct them to the chief nursing officer, right? Or to their PR department, so they can kind of get those um, coined spokespersons. And then also there are definitely some journalists who have some editorial bias. It's like, well, why am I asking a nurse? I should ask a doctor. So that's something that is also extremely misunderstood early on. I started when I really started media, I was a cardiac clinical nurse specialist. And I was inspired because my dad, who was a retired Navy, 22 years, um, they said smoke them if you got them. That's how he picked up smoking habit. And we know what happens with smoking. And back then, and even still today, big tobacco was not transparent with the health impact of things. And long story short, dad died of sudden cardiac arrest as a result of all these cardiac issues secondary to smoking. And so there wasn't a lot of community outreach. Doctor's visits were only 15 minutes. This was the time when statins were just coming on board, cardiac caths were just entering on the scene. And I had decided that I was so upset with the lack of education that my dad had received or my family had received. I was early college. And I said, you know what, I'm gonna become the best cardiac nurse in the world. I'm gonna teach everybody in the world all of the things that they can control and do to better protect their health. And I'm also going to get on this side of healthcare and make sure these people do better with our patients and provide better community education. So there was a story. It was about heart attacks, and I was invited to talk about the story, which I was very qualified to talk about. And I was told, "Hey, Alice, we got Dr. Manny's coming on. He's going to do the story, but thank you for your time." I said, "Dr. Manny's an OBGYN. Absolutely not." I said, I was made for this. This is what I do." And he says, "Well, but Dr. Manning's a physician." I said, "He's an OBGYN. Ask Dr. Manning. Dr. Manning delivers babies and he does this and that," which I'm totally fine with. But I'm just saying, as far as expertise, this is what I do. And I had to really kind of fight for my spot there. And I'm so glad I did it that one time, because I think that's the only time I ever had to fight for it. And because when I did this, they let me do the story. They said, "Oh yeah, Alice really does know her stuff." And so journalists don't always know what nurses are capable of. But then also we as nurses, um, there are barriers that keep us from talking stories. And many times if you're associated with a large brand, large hospital, academic center, a school, uh, especially if you're going to say your name anywhere in their name anywhere in there, they are they make it difficult for us to do those type of things. Um, and then nurses and our associates, we're not really great about networking with the journalists. We're not strategic about it. We're really great in our nursing groups and our nursing pods. But when it comes to kind of playing in the sandbox with other organizations or non-healthcare industry outlets, we're just not that good at it. But we need to be, because look, these are the kind of stories that nurses are being mentioned in. So labor, these are the stories where we don't even necessarily contribute to them. you might hear a sound, but we're getting talked about. Hawaii nurses going on strike. NICU nurse breaks the legs of 5 infants in the NICU, or like things about our labor, our profession, our work conditions. While those are important things to talk about, we're not necessarily doing the ones talking. We're just being talked about. Whereas we should be leading the conversations about health policy research. I mean, many of us go back to school, we got to do some project. There's some, we've done some research, or we know how to read the studies and then disseminate that information to the public, but we should be leading the conversations, talking about healthcare and legislation and practice policies as the person saying it, not just being talked about. And that really needs to shift, because this is where the research and the policy and the education, this is the stuff that's really influential with helping people to formulate their thoughts and their behaviors, like I was mentioning earlier. It's really substantive information. And there's a gap. Our nursing voice is missing. So I just wanted to show you just real quickly. This is a newsroom. They're watching every network. Every network is watching the other network to see what they're talking about, because everyone wants to be breaking news, to tell the story first. Oh, that's a substantive story. How come we didn't get that? So they want, when it comes to this stuff that we're talking, like the policy and health stuff, they're journalists. They're not nurses or doctors there. They don't necessarily have those important topics on the forefront of their mind. So that's where we can come in to help them. So okay, hold on, let's see. Okay, this is just this is this slide is just some of my experience. But as you can see by some of these titles, I didn't know I was doing this, but I'm weaving stuff in. So to talk about, you want to do some more advocacy. So I actually have some kind of case studies built in here, and we could talk about it. So I did a lot of work with the American Heart Association, naturally, because my father's I was inspired by my father, wanted to do these things. I started off doing blood pressures at clinics or at health fairs, this and that. And I'm educating, talking to the people. And someone said, "Oh, Alice, you really got the people like listening to you. But could you do a radio segment?" So I did a radio segment, and then I did another on heart healthy habits. Then I came back, got invited for signs and symptoms of a stroke, and then I started to do things aligned with that. But what I did was I aligned. I didn't look to align with them because I wanted to do this, but I aligned with the things that I want, naturally aligned with what I wanted to talk about. And he sent me an email and saying, "Hey, we saw you doing work with the American Heart Association. We have this Black Women's Health Initiative that we're working on, and we've seen that you talk about um, heart health a lot. Could you come and talk to our women about that?" But I also say this: takes a lot of work, takes a lot of time, and a lot of this stuff is unpaid, right? So you have to be very passionate about it, unless you have a business and you can somehow monetize it. Um, but one of the things I always recommend to nurses is like, let's take off the blinders. Let's look at the full picture of who's all impacted, and not necessarily those just directly involved. But we got to get out there, because once you do a radio or a podcast interview, you can, as seen on, and you can share that message. People will know who you are. So some of it is, if I looked at it like kind of and these are the things we don't think of as nurses. We think of it like, well, you kind of have to market you think of, oh, I want to advocate, I want to empower, I want to educate, but a part of getting that word out is you have to market it. And the way you can market that is using media as not only a way to amplify the voice, but also consider it like a form of advertisement, right? People will buy Facebook. People are familiar with, oh, I'm gonna buy a Facebook ad. We're gonna buy, but when you do it this way and you position yourself as an expert, a thought leader, you naturally get the eyes and ears of the media, and that kind of, I'll call it marketing, advertising, is priceless. But nurse, we don't think like, unless unless you're like a business entrepreneur, you might, most people see it that way. But I always tell people, what if you could just advertise and you didn't have to pay for ads? And at the same time, you could amplify your message and educate and do all that in one. Well, the one way to do that is media. But people, it's so underutilized, so underutilized. Um, and I tell my nursing organizations are getting better at it. They're getting better at it. But I think we just have to talk about it in this exact way, because it's not something that just come to us. Things that come to us are nursing things. But we got to think. We got to think. I don't want to say. We got to think like a business sometimes. We do.
Yes.
We have to think. Yeah. And I think like a politician. Politicians want to get out there, they want to campaign. So any microphone or television or radio interview they can do to campaign, they're going to do it. So we have to campaign as we advocate, campaign these important messages. Oh,
Thank you.
good. You're
Thank you.
welcome. Yeah, thanks. So I mean, and I will share these slides with you, but we definitely can translate a lot of our experiences, knowledges into impactful public messages. So, as Becky was talking about the RN compact license, how it impacts us as nurses and how we as nurses want to take care of patients, but we're unable to get into, there's so much red tape for us to get there, when there can be so much community benefit. And so one of the things in doing this is also knowing our audience. So, um, as we advocate and we create these messages, it's also very important that, and it's something I see underutilized is we'll have a message and we just want to share it. I want to share this message and I want to say this and I want to say that, but also take into consideration the audience. So sometimes, just like we individualize a patient care plan for that particular patient, right? I'll use this because I'm actually half Filipino, half Black. So if y'all, it's just fun fact. In the Filipino culture, there are certain foods that are high in salt. It may not be the traditional salt shaker that's on the table, but there are different garnishes that are salty. So if I'm going to educate someone who's Filipino who's about decreasing their salt intake, I have to be mindful of the foods that they eat, right? So same with our stories. If you have a particular story or a message that you want to share, yes, let's share that message, but also be very much into consideration about the outlet. So like, for example, maybe the news outlets, well, yeah, let's take news outlets and and this is kind of just in general, but there are certain news outlets that swing right, certain news outlets that swing left. I think for the most part, we kind of know those things. But to be most impactful, and I'll say this, I've done a lot of work with Fox News. I actually started my media career with Fox. I did Fox satellite radio for 2 years at 4 a because they're Eastern time, I'm in LA. To make their 7 a.m. call time, I had to wake up and be ready to go at 4 a.m. So 7 a.m. for there, 4 a.m. for me. I'd wake up every Friday at 4 a.m. Just 2 days prior, I'd worked with producers about a particular study. So, about how much sugar does the average person consume in a year, or whatever new study was out, I would talk about. So at 4 a.m., the producers would call, say, "Hey, Alex, okay, and when your phone rings, we're gonna buzz you into a different radio station, a different Fox satellite radio station. We're gonna tell you a little bit about them, but we're ready to go on your story. So I've had a story, I'm just ready to go. Okay, hey, Alex, um, we have Jeff and Ben in Miami, Fox News satellite radio," and I would tune in. But I knew that my audience was a Fox more conservative outlet. So when I delivered my message, I was mindful of that. I didn't change the core and the important pieces, but I was mindful about how I delivered. So when you have your RN compact license, how you deliver it, let's say you're going to deliver it to a group of, you're talking about, well, let me just say this. Would a group of automotive workers really care about RN compact license? Probably not, right? But they get to vote, but they still vote, right? So the way you think of that, and so you even tell your story like, hey, just how you say, your body's like a well-oiled car. You gotta, finding
Right.
ways to connect with them so so they feel like, oh my gosh, she's talking to me. I don't know about you, but there are times I've gone to
Mhm.
church and I'm like, oh my God, the pastor's talking directly to me, but not really, right? But just saying ways that were relatable that I could connect with. So I think that's one of the missed opportunities with nursing when we're advocating for things. We just kind of have this cookie cutter box and we want to stick this square peg in every hole there is, when really we can translate very important information and make sure that we know our audience, deliver real scenarios, obviously evidence-based, advocate with a purpose, and deliver to those leverage different platforms. You can tell this RN compact license to an automotive outlet, but there's a way to do it. So um, now, for sake of time, I have 4 case studies here. Let's pick one that y'all would like to go to, and I'm gonna give you the examples of how I was able to amplify the message with media and kind of the tips and tricks of it, if you will. So anyone have a particular, which one? We have COVID-19 vaccine, ARPs with the ACA and the state exchanges when those came out, ANA's End Nurse Abuse campaign, or some of the legislation that I did with American Heart. Which topic, which one would you like to go through? You'll get all of them in the PowerPoint, but anyone particular one?
Just go ahead and speak out.
Okay.
I'd like the
If
COVID
not,
advocacy one if we're picking one of them. That's really interesting to me.
okay. Okay. Yeah, and maybe it's because that was one of recency too,
And
right?
that's what I was gonna say. So 2 votes
Yeah.
for vaccine.
All right, there we go. Now, as we go there, understand when you have your, and I'm going to call it a campaign. I know that you might think like, well, this is kind of weird. I don't know. But when you're advocating, because you're generally advocating for something over a long period of time. So for the sake of, I'm going to use the word campaign. It's going to be really important that you collect and gather all your information that you need to support your cause. We're going to create this compelling public awareness initiatives. It's important to really identify who those stakeholders are. And especially if these are things that are going to impact law or governmental type of policy, whether local or federal, you got to engage the policymakers. You got to engage them. And then it's always cool when we can measure policy changes in the engagement metrics, because you want to measure how we're doing. So we're going to start with COVID vaccine. So I just have some screenshots. So I'm going to tell a story first. So obviously pandemic came. COVID-19, the SARS-CoV-2 virus. Nobody is an expert at that because we're all learning as we go because it's brand new, right? But one of the things that I did, because it was very obviously as healthcare workers, it's very important to learn about it, because not only would I need to know it for my patients, I would need to know it for myself. So I would tapped into the Los Angeles Public Health Department, California Public Health Department, and the CDC and the NIH. And I think at the time, Governor Cuomo, who was in New York, seemed to be the governor that was leading a lot of conversation. And I had to stay informed. But as I was staying informed, I would then share these. I would take my nursing hats, right, and understanding the research, the numbers, and how understanding how to then educate people to the latest standards or the latest legislation, and make sense of that for the communities I was talking to. So, for example, let's just all agree the CDC did a horrible job at rolling out information, right? Let's just agree to that, because CDC would make decisions. Those would then roll out to the states, but just like research, right? Research is done. It takes 7 years to get to the bedside to really be rolled up. Same with the CDC. They'd make decisions and it would trickle down to the state. They didn't have a good process with how to educate the healthcare community. So oftentimes there was things that were decided at a national CDC level. It's like, oh, you don't need to wear your mask, but we're taking the mask mandates away. However, in the state of California, and then probably even more specific, Los Angeles, that decision may not be applicable, right? It was dependent on your state. So oftentimes when the CDC would ease up on COVID restrictions, because California was we were the last state to come off of any type of restrictions. There would be the California, and then there would be Los Angeles. So oftentimes that's why I stayed connected with the California Public Health Department and the LA Public Health Department. So I would listen to those conversations. I would sift through that information. And then if I was doing if I did a news presentation or news topic or segment, I was always very clear to say, while the CDC has lifted its the mask mandates, it's very important for viewers to understand that in the state of California, we are still in a state of emergency. Most of California has not done, there are areas of California that have done so, but here more specifically in the Los Angeles area, we are still adhering to. So please, while you see the CDC saying you don't need to wear a mask, please understand here in the LA County area, it is still very much a requirement. So I had to edify myself a lot, but I did that because I really found a lot of passion in doing this. But then I also collaborated, right? So I would do Facebook lives with the NBC community, and while it was LA, a lot of people tuned in to LA because sadly enough, even though there are multiple NBC outlets, not all of them have a go-to health expert. They just don't. Um, I happen to be one for Los Angeles, so I literally was doing television like 3 times a day. But my employers at the time were aware of my role, and because of the importance of it, especially when everyone was shut in, they allowed me to do it. I also collaborated with journalists. I collaborated with journalists. So this one I did was with the National Association of Black Journalists in Los Angeles. Here you had the LA County health officer that I collaborate with, but getting in front of journalists to make sure, because I can't be there, I can't do everything. So, but getting in front of journalist groups to educate them about this is important, this is why, and this is what people need to do, and here's your resource. So then they could then snowball and tell the stories. Um, when you also with uh, collaborating with some of your more kind of popular outlets, you know, kind of this one was the Facebook Live, and I'll say this. And I'm going to go ahead and say this with and feel very bold in this. Blackdoctor.org. So this was March 30th. I think the state went into shutdown May 20th around that time. I don't know. Someone maybe fact check that. But there was the the president when he said we're all shut down. This Facebook Live is one of the earliest Facebook Lives to have occurred. We had over 300,000 people live on Facebook tuning in for the latest information on COVID. It was myself. We had a licensed psychologist to talk about the mental health aspect of it. We had an emergency physician. And then we also had Dr. Shepard, who was OBGYN, women's health, to kind of also talk about that piece. And we did, I think we were on for about an hour and a half, maybe 2 hours. And we basically gave kind of, when everything was shut down, kind of gave a state of emergency of this is what you need to know. This is how you prepare. This is what you need to do. And this was a conversation where, unless you were, let me be honest, most doctors didn't know. They didn't know. They didn't know yet, right? Because it was so new. But all of us on here have done media before. We were very in tune with the latest, and we did this advocacy program, which got shared. I also had the opportunity to talk with Dr. Fauci and lead a conversation for a large group of nurses and what this means for us. So I don't, and part of this feels weird because it feels like I'm bragging, but I want to give you examples of the different outlets and the things that you can do to champion your message. Because once you get it to these different places, like let's say I did this with NBC. NBC then shares with its followers. I did this with the Black journalists. I'm there, and then the Black journalists, that organization shares with its members, and then each of those individual journalists go back to their outlets, their various outlets, and then they champion the story. Um, Dr. Fauci, obviously, he was doing interviews left and right, but I did this with the nurse. This was very nursing specific, so it got shared through many nursing outlets because he did meet with a select few of nursing outlets. Obviously, his time was limited and he was doing work, but I got a chance to speak with him. I worked with AARP. Now, this was California, but then this got shared to other outlets. So, mind you, I'm being doing advocacy not just for nurses, not just for journalists, not for just the general public, but also targeting some other communities. So, for the 50 and up group. And actually ARP, you know, they actually, anyone can be a member. You don't have to be, wait till then, but I got to talk to them about, because, you know, there were so many questions, like what was going on at the time. People, there were testing sites coming up. People were afraid to go to them. They didn't know what to expect. They didn't know where they existed. They were afraid of sticking something in their nose. And so a lot of advocacy about, okay, this is what's going on with COVID-19. This is how you protect yourself. Here's swabbing and tests. And then once you get swabbed, what are you supposed to do? Or what do you do if your mom tests positive and you're in the same home with her and you can't social distance? So this was a lot of education and advocacy going on and encouraging people to get tested, right? Also, If someone got, and then also think about when the vaccines, there was lots of controversy and fear and conspiracy theories about vaccine. And then think about when ivermectin was coming and hydrochloroquine and all those things were coming on. And now I know why the data has shifted and changed to favor those things. At the time, people were going to aquarium stores and buying this stuff and trying to take it. And, all of these things, we were coming out with so many different treatments and therapies, and people didn't really understand. So these are really opportunities to advocate and educate to help keep people safe. I also did it with my Hispanic communities, and this one was a collaboration with even a health. This was a Blue Shield, but even them shared. They took that information and shared it with their their clients, and then obviously it went other places and within the Hispanic community. So there's just so many opportunities, and I'll just be honest, and this is just kind of a snapshot, but I think that when we have a campaign, when we have something that we want to advocate about, I don't know that we think big enough. I think we just think of the kind of the most obvious groups and we go there and we're hoping that it just gets out. But the truth is in order for it to get into those other areas, we have to strategically, politicians do this all the time, strategically work with groups or with outlets that can help amplify the message and be our cheerleaders moving forward. Let's see. I did articles. I did as many panels that I could. I wrote articles. This is Nancy Wakefield. Do y'all remember Nancy Wakefield? At the time, she was kind of considered the highest nurse of the land. She was the first nurse under the President Obama's administration to be designated Secretary of Human and Health Services. So I networked with Mary Wakefield. I actually aspired to have her job one day, but then I realized, well, that's a lot. So I didn't, reality hit me. I'm like, okay, I'll do this on my local level. But I actually collaborated with politicians. Oh wait, this is data. This one's a state exchange. Sorry, that got mixed in there. But oh wait, so wait a minute. Nancy Wakefield was Nancy Wakefield was pre-COVID. So this is for something else. She was with the Affordable Care Act. But I will say this because I think my slides, I think I was sorry. I think my stories are blending a little bit here, but Nancy Wakefield, who I guess by virtue of her position could be considered someone who's a politician. She was in that sense, but it's very important that you also network with your politicians. When with COVID, I also got invited to several town halls from different congressmen and congresswomen to talk virtually online. But so, I was passionate. I knew that there was a need. And then I made time for it. So I think also sometimes when we have these advocacy things that we want to do, I'll be honest, we're also limited with time. So that's why it's important to collaborate with organizations, do things digitally. Everything's going social media, online, and spreading our message. You never know who's listening. I was taking care of a patient one time in an emergency room, and I was preparing to do a critical care transport. He'd had a heart attack and needed to go to a STEMI center. Very tall guy. He was in the ER. They didn't change his clothes. Big cowboy hat, big belt buckles, jeans, the cowboy shirt and everything. And then I'm talking to him and everyone's masked up and gowned up. And then I'm talking to him and he says, are you that Black nurse that's on television talking about health stuff? And I said, yes, sir, that's me. Are you ready to go? You're having a heart attack. We got to go. He said, wow, I learned so much from you. And and the only reason I said that example is I guess not consider, I just didn't consider, although everyone's a patient. When I say you never know who's listening, I guess thinking of the cowboy hat, the boots, and the big belt buckle, I just didn't figure that was someone who'd listen to me, right? But you never know who's listening to you. He said, I got to call my wife. I said, okay, we'll call your wife and get on the gurney. You're having a heart attack. We got to go. So, but really, I think nurses, we really need to step into this place where I won't say that there's a seat reserved for us, but there's definitely a place for us to champion important health messages and policy and practice, and that we're just not doing it. And I think once you step into that into that seat and you realize the ride that you go on, you're going to look around like, why didn't I do this before? So I really want to encourage people to use media. And if you need steps on, okay, so this goes into the other campaigns. Let's see, we kind of talked about this, health education awareness. These are examples of different topics I've talked about. Advocacy influence. We really got to step in there. Health policy advocacy, crisis response, and then Becky, since you gave that example, RN compact license, any opportunity you have, tie this into a story. You say, you know what, it is California's not a compact state. If we had a compact state, because I know we're going to need nurses out here to take care of people, we have an extreme shortage, and in a sensitive way, right? It's very unfortunate to see all of the devastation that California is going through. We can only anticipate the amount of injuries, smoke inhalation, and all of these things that's going on, mental health services. And so, to support that workforce, it would be extremely beneficial if things like RN compact license were a thing. What is an RN compact license? It's this. But see, you tie it in that way. That's how you got to do it. Pull on those heartstrings. Yeah, this is one I did with, I was literally, in this role, I was acting as, in this particular role, I was a nursing instructor because Charles River University was one of the testing sites. And I had students at that university. Across the street was Martin Luther King Hospital. And this was I think the second largest testing site. People were afraid because they didn't want to stick anything in their nose. And so I NBC would come and cover me live and I talked people through the station. And once we started to do that, we saw such an uptick in people coming out. Once they saw like, okay, this is what it is. This is, okay, then I'll go. So, I mean, doing that, whether you call it reporting, whether you call it advocacy, whether you call it education, it's using media to inform the masses. And when I started to do these stories live on set, all of a sudden, so I did it because I worked at the school. And so the dean was like, sure, Alice, because it's good for the school, it's good for the testing site, because it was a federal testing site. And then I did it with NBC. I did it a couple times, and the next few days, I promise you, and this is, now I'm a little bragging. You saw all of the news stations come out now, and then they're educating. But great, that's good because someone might be watching Fox, someone's watching ABC. Let's get them all to the testing site. But that's where I really found, it really made me feel good to get that information out to people. I've talked on hurricanes, all kinds of stuff, different studies, from opioid pandemic or opioid addiction, all kinds of things. Nurses, so whatever your specialty is, whether it's women's health, maternal health, whether it's, nursing practice, maybe it's about smoking cessation, maybe it's about, I don't know, food and nutrition, whatever it is, there's so much you can share and do using media. And these different, now I know people don't do, this is when it was Twitter, now it's X, I know. But I mean, there's so many avenues in which to utilize it. And you don't have to do them all. Maybe you just start with one and you use that, get your sea legs, get it operationalized, get it up and going, and then you tackle on another one. Or you create a piece of content on one platform and then you share that exact recording on other platforms. But getting the message out there is important. Using health literacy, using my nursing knowledge. We can talk very high level medical mumbo jumbo, but then using health literacy and making it digestible to the audience in which I'm serving, whether it is like the when I did the COVID education for the Hispanic audience, whether it's that, whether it's doing something for mother babies, maybe it's something for automotive people, but making sure that I customize it just enough to be relatable to that audience. Then that's how you can do it. Hold on, I have a, obviously we're going to be integrous when we do this. No sensationalizing stats, making sure it's evidence-based. You got your stats and everything with you when you're doing this, mindful of HIPAA. Best practice, our ultimate responsibility is to educate, right? And empower people with information. But here you go. How to increase your visibility in media. So there are some places that have media training. I think this is something that should be a part of nursing leadership, or at least an elective in school. You could take public writing, journalism classes to sharpen your communication skills. I don't know if people probably don't do as much. I used to do Toastmasters and stuff at work on my lunch break. You know, we also need to update our organization policies, because some of our organization policies only stand that one person can do it. Well, what if that one person can't be everywhere? So what do they say? If you want to go fast, go alone. If you want to go far, go together. So we need to do that. We also need to make sure that you introduce yourself to the respective PR media departments at your hospital or clinic, wherever you're at, your company. Introduce yourself to local TV and radio stations, newspapers, and let them know, hey, I'm Alice Benjamin. I'm an emergency room nurse practitioner. I would love to, I'd love to be a resource to you when we have any type of healthcare coverage or anything health inclined. And then also, I'd love to pitch you stories, things that are coming up that I think your viewers need to know and would benefit from. Make sure you send out press releases. So, Becky, when you do if you're going to do like a webinar or something on the RN compact license, maybe you share that, make tape a press release and share it with your local news stations. You never know. Sometimes you're like, oh, no one's going to care about that. It'll make the newsroom, and you never know. Journalists might just register and listen in and be able to help tell that story. Some other things is create our own content. So if we have our own Facebook, our own Instagram, our own YouTube, we can do that. Collaborate with media affiliate associations. So whether that's there's the there's the American Healthcare Journalists Association, National Black Nurse Journalists, Hispanic, Asian, like there's one for every group, right? But partner with your media affiliated associations and then pitch the topics you'd like to discuss. When we don't pitch, sometimes I think some of our mistakes is we wait to be asked. Don't wait to be asked. Invite yourself to the party. And then I'm almost done here. And then this is a shameful plug for me. Because I've had all the experience, I'm actually have a media leadership book that talks about some of these things the exact same things we talked about, but in a lot more step-by-step detail. I hope that the book should be in hand in March, but later I'll announce pre-orders. But I have this leadership book. There'll be an Audible. So if you're someone who wants to grow more in this, by all means, if you're interested, that'll be coming. Some free articles here if you're interested. I'm also the chief nursing officer at nurse.com. Here are some free articles you can look at right now. If you go to nurse.com/nurse Alice, I have this landing page, and at the bottom, you'll see all the things that I've written. But here, from bedside to breaking news, 10 tips for you to engage media, share them with your organizations, and then and a little bit more about nurses being a missing voice in healthcare advocacy. That's a resource for you if you're interested. And then on my website, the MediaRX.com, I have a free downloadable book. If you want, like, I need to brush up my interview skills. What should I do? All the do's and don'ts, how to prepare for that interview. I have a free downloadable if you'd like. And then I'll leave you with this. As healthcare professionals, amplify your impact beyond clinical settings by engaging in responsible health communications through media channels.